and online. And I hope that you feel the energy. I hope that you feel the love that's coming through the screens, because I feel it. I feel it through your comments. I feel it through your presence. And I'm excited to bring to you all our next speaker. You know, we've talked a lot about maternal health and mental health and having a therapist and a counselor. So of course, I'm going to bring you somebody who is a licensed therapist to talk about just their experience with infertility, because they battle infertility, but also, you know, what we should be asking our clinicians, our therapists, our counselors as we navigate these transitions through our journeys through motherhood and parenthood. So without further ado, I'm going to go ahead and share my screen and introduce our next guest, our next speaker for today. All right. So Dr. Lori Johnson is going to speak on therapy and fertility and why it's important. You know, how do we seek a therapist while we're on our journey to parenthood? So Dr. Lori Johnson is a licensed marriage and family therapist and coach in a private practice with more than 25 years of experience as a clinician, educator, and clinical supervisor. Specializing in women's mental health and reproductive health, Dr. Johnson helps her clients overcome the emotional challenges that come with fertility challenges, including pregnancy loss and emotional trauma. She also helps couples who have become divided in their fertility journey strengthen their connection. Dr. Lori was also featured on the Sisters in Loss podcast back in episode 144. So definitely go listen to her story more in depth. But what I love about Dr. Lori is Dr. Lori be dropping gems, y'all. If y'all don't follow her on Instagram, y'all need to go follow her today. And really how she partners, you know, her experience as a therapist, but with her own personal experience battling infertility, and how compassionate she and with so much care that she gives the community. So I would love to welcome you all, Dr. Lori.
Okay.
Here, hi, Dr. Lori. Thank you so much for being here.
Oh my gosh, thank you for having me. I just, I was so excited about this event and, just what you've been creating for us in the community. And so thank you for this space. And I'm just so honored to be a part of it and to take part in speaking with all of these amazing, talented women. It just, I feel such pride being here today. So excuse me for a second while I just geek out for a minute.
No, we gotta have that moment, that we have to geek out and have it, because everyone's been dropping gems, and everyone it's almost like, it was curated the right way. Obviously, planning a summit, you want it to flow in some way, shape, or form. And it seems like everyone is just building on top of each other, on just, acknowledging our bodies, knowing our health options that we have out there, and just really researching it for ourselves, because ultimately we have to be able to trust our bodies and ourselves. But what comes with that is really trusting our mind and getting our mental health together as well.
Definitely.
We grow up believing that it's easy to get pregnant, right? We talk about this, that as soon as you want a baby, it'll happen. But that's not the case for everybody.
No.
So why is it so important that we have therapy as a part of these journeys that we're going through as we battle loss, as we go through infertility? Why should therapy be the cornerstone of as we navigate those journeys?
Yeah, so I love how the trend is changing a little bit in our community towards embracing mental health, because we really need that support when we're going through this. Like you said, we're taught very early on that basically, this is what you do to have a baby, and it should happen relatively quickly. And when it doesn't, obviously you feel some type of way, because I think one of the unifying threads with a lot of what the panelists have said so far is that, we thought that infertility issues didn't impact us in that way. So this is a narrative that a lot of us are still walking around with. So when you have that narrative and you're dealing with wanting to get pregnant, not getting pregnant, or if you've gotten pregnant and sadly lost that baby, that creates a very just very stressful kind of emotional experience. And you need some place to tend to that. And when we think about infertility in particular, we think okay, this issue is just going to affect, infertility, but infertility, pregnancy loss, all of those stressors are like this interconnected web, and it impacts our emotional well-being. So anxiety, depression, feeling like, what's wrong with me? Why isn't my body working? Those messages are coming out so powerfully. They're all, infertility or loss, they're also impacting our relationships with our partners, because for those of us who have gone through the treatments, and we know that our lives are basically ruled by doctor's appointments, schedules, timed intercourse, procedures, medications, you name it, it's incredibly overwhelming. And so when you're also kind of trying to deal with that in your relationship, and let's face it, a relationship is challenging in and of itself without fertility issues. And then you add another layer on top of that. You need that support, because stress upon stress upon stress is just too much. And if you think about our emotional capacity like a container, there's only so much that you can put into a container before it just, it starts overflowing. And so that's where therapy is an important part of the journey, to allow you space to discharge some of that stress or manage it differently so that it doesn't like resonate in your body. Another area too that I see impacting the lives of the clients that I work with, and also my own, because I think you mentioned that I'm part of the community. I'm not just a clinician, but I am a part of the community too. Is our relationships with family and friends. While well-meaning, people that aren't in our world don't necessarily know what to say or how to support us, and sometimes they say the wrong thing trying to be supportive, and that can also be, so therapy can be another way of trying to process that and help, figure out ways to share our feelings with those loved ones, and maybe coach them along or give them resources that, I've been posting, or other women have been posting, accounts have been posting to help our loved ones learn how to support us better.
Yes. So tell us, how do we find a therapist that specializes in grief, loss, and infertility? Because I think what people don't realize is that, people say go find a therapist, but they don't all specialize in what you're looking for. So how do we find them? And then what questions should we be asking them so that we can make sure that we're a good fit?
That's a great question, because right now I think there are some really great referral sources for women. There's therapy for Black girls. There's Black female therapists. There's a Black male therapist. So those are three referral sites right off the top of my head that I think would be a good place to start. And usually with these referral sources, they can you can apply filters, or look for certain areas of expertise. And so usually people will say that they specialize in grief, they specialize in maternal mental health, reproductive health. So you want to look for some of those keywords to help guide your search. Now, once you get there, there's so many different types of, obviously, therapists and training that we have. And I always say, look at the website and trust your gut, because we could talk about, okay, what's their training, what certification, what program they came from, and using that criteria to try to determine who's going to be the best fit. But one of the things that I believe is that a personal connection is it's the biggest therapeutic tool. So talk to them, see if the words jump out on the page. Do they, and listen to how they talk with you about their experience. So usually we offer a 15-minute consultation, and that's a great way to, or I do, and I know my other colleagues do as well. And that's a great way to kind of get a feel for, does this person really hear what my struggle is? And do I feel seen and validated? And so I would trust your gut, and because usually people will say, the connection just wasn't there, but I just went with it anyway. But I actually would kind of, aside from kind of coming up with like these questions, I think, asking yourself relationally, okay, how good a fit is this? And, do I feel supported?
Yeah, something that we haven't really touched on today is male
Hmm.
factor infertility.
Hmm.
So, if there was infertility that was diagnosed and it was male factor in particular,
Hmm.
should the couple go to therapy as a couple or individually if they are dealing with male factor infertility? It is something that we don't even talk about really in general amongst Black people, but
Right.
it's so common and it happens and it affects the couple and the relationship, as you mentioned. So,
Hmm.
how would a person navigate male factor infertility if their partner is the person who's experiencing it and they're trying to move forward with their journey to parenthood?
So first of all, I just want to say, just be very gentle with yourself and with your partner during this, because one of the things that we know about mental health, women are more likely to reach out for therapy than our male counterparts, and women are the first ones usually to reach out regarding fertility treatments, as opposed to our male counterparts. So what that means or translates into is more of a delay in men accessing care, and so what I would suggest though in that situation is, still go individually to get the support that you need, because as a couples therapist, one of the things that I still believe in is that when we focus on ourselves and we look at how we're impacted by what's going on with our partner, then I think we can find different ways of reframing our partner's behavior and also being as compassionate as we can. That sometimes helps create a shift that allows men to feel more comfortable in accessing treatment as well. So don't be discouraged initially if your partner's like, nope, I don't want to. There's a lot of shame and toxic masculinity that I think gets wrapped up into, the male factor issue. And I think that it's, what society says about what it means to be a man in our, in our community. And then to come find out, okay, there's a fertility issue. There's a lot of pressure there. And I really commend the people who are talking more about it, and advancing these difficult conversations. I know that Eloise was on earlier talking about egg donation, and that is a huge issue that I'm seeing in my practice as well. So with the women that I'm working with, and I just think, the more that we talk about it and release that shame, it makes it more okay for us to support each other and to work past that, so that we can kind of actualize the dreams that we're all here to do.
Yes. So, I have a therapy relationship. The
Hmm.
doctor works with me through my loss,
Hmm.
through, getting pregnant again, having my rainbow baby. When do
Yeah.
I know it's the right time to end that therapy relationship?
Hmm.
Or, do I stop therapy just because I have my rainbow baby? What if I want to conceive again in the future? How does that work with therapy? How do we really know when to stop our therapy relationships? I guess that's the real question.
So I think there are a couple of ways that you know when to stop. And sometimes when therapy is just kind of goal oriented, when you reach a goal, then I kind of ask my clients, okay, how are you feeling about stopping? What does that mean to you? We might try to space appointments out, seeing how that feels. And usually there's this kind of natural progression that means we're moving towards, towards closure. Now, the thing is that when people have their rainbow babies, and I think they kind of think, oh my gosh, everything's going to be just kind of fine. They realize that, okay, motherhood is going to be difficult, but that postpartum period, the fourth trimester, is intense, or it can be intense for some women. You've just gone off of, or just come through a period of time where you might have been in treatment for months or years, and then on top of that, you've grown this tiny human for 10 months, so more hormonal shifts, and then you kind of you come to this arrival of this beautiful blessing, and it's not all like roses and rainbows. So I usually like to make sure, or say, let's stay connected during your fourth trimester, just to see how things feel. But also it's more of a collaborative discussion about, what are the needs? Are they still feeling really anxious, still struggling with depression? We know that the postpartum period is still a very delicate period of time for us, and we're particularly vulnerable to that too. So I don't like to withdraw support too quickly or say, you know what, you're there, we're done. That's not necessarily how I roll. But, it's totally fine for people to say, you know what, I need to take a break. I've got too much going on schedule wise, but, I'll still check in with them. Like, hey, just how you doing? A little email here or there. But I think it's not a hard and fast rule in terms of when do you stop. But I think it's important to talk with your therapist about the reasons why you want to stop and see what makes sense for you.
Yes. So, someone asked, what if you need therapy on other things besides fertility? But
Mm-hmm.
I think I think therapy is needed for everybody and everything.
Mm-hmm. Mm-hmm.
So whatever you
Yes.
need, you can
Yes.
probably seek that through with the therapist.
Yes.
But I guess, we talked about kind of holding on to hope,
Mm-hmm.
with any journey to motherhood. As you navigate it, you go 2 steps forward, you go 4 steps back, you get hit with bad news.
Mm-hmm.
How do we continue to show up for therapy when we feel like giving up on our journey? Because sometimes it gets that way. It's like, I don't really want to go talk to this therapist because I just don't feel like it right now. Like I got,
Yes.
really
Yes.
want to move forward with this because right now life is hard, especially right now in this moment where we're in, where we are dealing with the stress and the trauma of COVID-19 and now going into the holiday season and not being able to see our family and friends like we want to because of this virus. So how do we show up for therapy even when we don't feel like it? I think we've all been there.
We have, and and your therapist has probably been there too. Just full transparency, we're human in all of this. So
Yeah.
I tell people, so I say to people, I really honor, come as you are, and what that means is bring that to me, and let's talk about why don't you feel like coming? Yeah, tell me about that. The fact that you're losing hope. That's understandable. Tell me more. I want to hear more. So I just really want to join with them around that. And, and I usually say, we don't have to make any major decisions right now, or you don't have to make any major decisions right now while you're feeling at your lowest. So have your feeling, and then once this is passed, or there's some more time has passed, let's go back to this and see if you're still feeling in that same spot. So that's where therapy can be more of a holding pattern, because we know what your larger kind of goals are when you're coming in specifically for fertility stuff, and and also we know the highs and lows, the roller coaster that you can go through, and so it's perfectly normal to cycle through the times where you're really on board and really invested, and times where you're just like, I can't do this anymore. I'm done. And, and everybody comes to their realizations differently. So my job at that point is really more about holding that space, continuing to be your cheerleader, regardless of whether you are, like just really high up, or if you're just like feeling really hopeless. But come as you are.
Yes. So I want to kind of transition into your own personal journey, because obviously I know as a therapist, as a professional, you can't bring that into the therapy room. But I feel like, when you have a therapist who has gone through loss or has gone through infertility, it's just a more of a sense of compassion that they have, and empathy that you have towards your client. So how do you show up for your clients, especially when they're dealing with loss and infertility diagnosis and just the ups and downs of what this journey can lead them on?
Yes. So for those of you who don't know my story, I have, my husband and I have been together for 10 years, married for 8. I was one of those fabulous late bloomers in life. So that one of those, that's my code word for like the older moms, because, we kind of get labeled a certain way in the community that just doesn't feel great. But I was very naive, and thinking that once I got married, that it would be, I knew I was in my 30s, that it would be a little, a little challenging to get pregnant, or more challenging. But I went through a series of losses, and the one that people will probably hear me talk the most about is my son, that we lost at 15 and a half weeks gestation, and so. And then after that, we went through, I had 2 pregnancies without assistance. And then because of my age, I went through IVF, a series of IVF cycles, and that resulted in two early pregnancy losses. So my process has really changed who I am. I was already working with women in the community, earlier in my career. So I was, connected to the infertility community, but there's something about going through this personally that just completely alters you. It changed who I was as a person. It changed who I was as a clinician, and I've spoken very openly about the fact when I came out of this very intense grief process that I just felt like I'd been reborn, and I just couldn't stop talking about it and wanting to make sure that I supported women in ways that that I felt supported. And I had some different challenges being a therapist, being a Black therapist, and also trying to find a Black therapist for me at this stage. So I had to piece together my support, and so that's also another thing that really impacted why I decided to rejoin the community in this way, because we need more visibility. And, so I feel so passionately about women not feeling as alone as I did going through my loss, or going through this fertility journey, or assuming that, and I was still part of that wave of women that where we, the message was still really strong from doctors, other professionals, that infertility didn't affect Black women. So I had that in my head, and and I'm going through these losses, and I'm just like, well, I'm just, it's not happening for me. What's wrong? And so yeah, and I'm glad to see that we're just kind of blowing the myths out of the water, and just shining some light on that, so we're not feeling the sense of shame. And so that's a little bit about my story, and how I've kind of came to be here, and where I'm at right now, and how it informs the work that I do.
No, it does. It absolutely does. So I would love for you to really talk about your work, and how can we stay connected with you?
Yes. So I obviously am, I see clients, I'm able to see clients through my therapy practice for people who reside in California. Now, I do some work through a coaching capacity as well for people out of state, but people are able to connect with me on Instagram at Dr. Lori Johnson, and that's DrLoree, Johnson, common spelling, or you can go to my website at drloriejohnson.com. And that's where I talk a little bit about more. I do some individual work. I like to work with couples as well. But my specialty is also working with trauma, infertility trauma in particular, and I do use an EMDR, which is a trauma therapy protocol, to help women reprocess the experience of trauma in their bodies. And so we know the whole mind-body connection is really intense, and so and that does impact our fertility. So and it's been a powerful modality for a lot of my clients, and moving past a lot of the blockages that infertility can create, and actually help them, feel, I think, as good as you can feel after having suffered a loss, and moving forward to the next step. So that's a little bit about my work and where you can find me.
Good. You all have any questions for Dr. Lori that you want to put in the chat box? We still have a little bit of time, about 7 minutes. Any questions about therapy, your mental health? We talked a lot about the naysayers before, in a couple other sessions with some of the other speakers, the negative Nancy's that always got something to say.
Always have something to say. And, and I think you had Reverend Stacy on earlier, and I feel like it's what I'd like to see, and I really appreciate too, is just more of our faith leaders talking about therapy. And, because obviously faith is so important to us. And it's a beautiful organizing principle that just helps us feel so grounded. And I just, and I'm speaking from my personal experience, because but also for some of the women I've worked with, it was hard to kind of embrace, my identity as therapist, and also with this religious background that I, kind of grew up with and, or was taught. And so it's nice to hear other religious leaders talk about, or just talk about the importance of, mental health, and you can have your faith and your feelings, and I think, as Eloise pointed out too, it's like faith without works is dead. And so, just because we're seeking therapy doesn't mean that we are not, trusting God or trusting the process. It just means that we're using the tools that were created to help us, get to our goal.
Yeah, someone asked, could you list those therapy resources that the directories? You mentioned Therapy for Black Girls.
Yes. Blackfemaletherapists.com and Therapy for Black Men.
Okay.
I think I have that right. That should be, yeah.
And then someone also asked, do you do EDMR virtually? Is that
I do. Yeah.
Service? Okay.
Yes. I am completely virtual because I work with women in the infertility community. I will probably be one of the last people to go back into the office, because, when you're going through treatments, and basically because of COVID, you have to be, I think, a lot more careful than everybody else, because, some of us are having to test before procedures, and then you have to kind of quarantine and make sure that, you're not engaged, interacting with anybody. So, yes, so that's a long way of saying everything is virtual. EMDR has been adapted for virtual practice as well, and we've seen some really good results from that. So just as effective as doing it in sessions. So that's a good thing.
Good. Any other questions for Dr. Lori before she goes? I think that maybe it's a little delay, so I was trying to see if there's someone asked to explain what EDMR is. What's that modality that you use?
Oh yes, I'm so sorry. Yes, just spouting off. EMDR stands for eye movement desensitization and reprocessing. And so what it is it's a trauma modality that was born probably about 30 years ago, and it was used mainly with people who had gone off to war, and what we were starting to see over time is that, we could start to apply it to other populations that would have not just like these big traumas, like war or assault and things that we might stereotypically associate with trauma. But now we know that infertility can register as a trauma. It doesn't mean that it will register as a trauma for everyone. It means that it can. And so if you're experiencing heightened levels of anxiety, meaning like some people really struggle with going to their doctor's appointments. So for women who have gone through significant pregnancy losses, and I can actually attest to that myself, going to the doctor was a really big struggle for me. I had to do a lot of work and preparation to get myself to a space to go to the doctor after my losses. So those associations, it's kind of reworking our experience of those associations so that we're not in a constant kind of triggered state emotionally. So it's working with the body a little differently to help people feel less triggered.
Good.
Okay.
All right.
Well,
thank you, Dr. Lori. This was awesome.
Thank you for having me.
We'll talk soon. You have a good one.
You too. Take care.
All right. Bye-bye.
Okay. Bye-bye.
Oh man, I just saw your comment too, Darina, as I let her go. But hopefully she'll stay around in the comments and she can answer that question for you. because I think that self-care is something that we all should be taking care of, especially for our therapists who have gone through traumatic experiences, so that they can be connected with one another. So that's such a great question, Darina. Hopefully Dr. Lori will be able to answer that for you in the comments. So this is good. All right.